My name is Emily Edmondson, and I did this presentation over Jane Cook Wright. Jane was born on November 20th, 1919 in New York and died on February 19, 2013 in New Jersey. She was the oldest of two daughters. Her father was one of the first African American graduates at Harvard and later went on to become a researcher, and her mother was a school teacher. Her father also inspired her to pursue medicine in the biological field. They also went on to produce techniques to target cancerous cells together in their later years. She was married to David Jones, who was a lawyer, and had two kids, Jane and Allison. She had a 40-year-long career and was referred to as the godmother of chemotherapy. Some of her many accomplishments could include, in 1952, she took over the Cancer Research Foundation from her father at Harlem Hospital. In 1955, she became the Associate Professor and Director of Cancer Chemo Research at NYU Medical Center. In 1964, she was appointed by Lyndon B. Johnson to the President's Commission on Heart Disease, Cancer, and Stroke. This was a treatment center for critical diseases based on commission work. In 1966, Wright was appointed by Johnson to the National Cancer Center Advisory Board. In 1973, she served as the Vice President of African Research and Medical Foundation, and she also authored about 135 scientific papers. Wright can be attributed to many different career paths, such as a researcher, a teacher, physician, administrator, and a surgeon. Her two most notable being a researcher and a surgeon. She explored anti-cancer agents and the relationship between the patient and the tissue culture response, established non-surgical procedures for how to deliver chemo directly to the target, served as chief resident at Harlem Hospital, then went to work as a physician for a public school for about 6 months. After that, she left and joined her father with his progression on anti-cancer chemicals and research, and they were able to find remission between mustard gas and leukemia, and then they also founded that methotrexate had positive remission between cancers such as breast cancer and skin cancer. She also worked overseas in places like Ghana, Kenya, China, Europe, and Africa to not only treat other cancer patients, but also teach physicians and other oncologists. Wright also set a new precedent for women to follow, seeing as though at this time a woman's role was to take care of children, have children, clean the house, or cook. About 5% of females were doctors at the time, and about 30% of females are doctors now. She also set many firsts for others to follow, such as being the first African American woman of 7 to be admitted into the American Society of Clinical Oncology. She was the first African American woman to be Associate Dean of the New York College. She was the highest ranked African American woman to be at a nationally ranked college. And she was the first woman to be president of the New York Cancer Society. Not only that, but she also proved that you can have both a family and a thriving career as a woman, seeing as though she was raising 2 kids and still pursuing her career while constantly receiving accomplishments and awards along the way. Wright changed the way people viewed medicine through her different techniques still used today. Previous to this, people didn't know too much about chemotherapy, from how it worked to how to use it. It was still in its experimental stages at the time, before her advancements. Her father and her were able to come up with a few different methods, such as the combination chemotherapy being one. This is where you use different medications in a certain order to target the cancerous cells. Her father and her also concluded that cancer research and testing should be done outside of the body versus inside the body. For this, they would cut out part of the tumor, culture, and test different medications and procedures to find the best outcome. Previous to this, they might test on a mice or test just on the person themselves. Wright is also credited to developing non-surgical procedures to deliver chemo to the body. Before these procedures, chemo was not able to be reached to the spleen or the kidney. Wright can show importance to history through her race, since most African American women at this time were shunned away from the scientific fields. She can be a role model and show representation for African Americans since many stories and accounts of achievements may go unnoticed. This can relate back to Thomas King's book and Adichie's TED Talk through how many stories are skewed to fit this westernized lens or not even be mentioned. Hers is one of those stories that is not mentioned in the history books but should be and is relevant to this class as well. She should be mentioned in the history books due to advances on cancer and how to combat cancer, along with her first advances on chemotherapy. This is important especially during that time in regards to her race and to her gender. Overall, Jane C. Wright not only had many advances for African American women, but also to those in the medical field. She tested new techniques and treatments that were priorly not tested to combat cancer with chemotherapy in the best way. She can be seen as a great role model to kids and adults alike through her many accomplishments, rewards, achievements, and through her balancing of a family life and a work life. Overall, she is important due to her many breakthroughs in the face of many hardships during this time.